You're going to find people who are passionate about mental health, chronic pain, recovery, and health issues, and you're going to give them tech. You're going to find the people who are already passionate about sharing, about helping people, about lifting people back up, because you've already realized that no matter what we do, no matter how good the AI is, it's only going to be as good as we are to each other.
My name's Sabrina Ramana. Super excited today to be speaking with Yusuf Jones. He's an AI Solutions Innovator and LLM Engineer working at the intersection of mental health and technology. Yusuf, would you like to introduce yourself to the audience?
That does it. That's me. I've been involved with AI for about 3 or 4 years now. I've been in technology for a good part of my life. Started off as Oracle database engineer, then a Java developer. And the idea was that at the intersection of mental health and AI is where I found myself. I just see that need. And so now we're developing a lot of solutions that have to do with helping people become better with each other and better to themselves, because that's how we get ultimately better AI. I know that's my idea.
And how'd you that jump? So you went from tech to mental health. What was that transition like? And what was the catalyst for that transition?
This was 5 years ago. I was paralyzed from this down, and I had a spine injury. I was paralyzed, done. Funny enough, the isolation of healthcare and the struggle to come back hit me in so many different ways, psychologically and physiologically. It got to a certain point where I decided that if I was going to jump into something, it was going to be something that I was going to use to help other people through this same thing. I was crawling around on my hands and my elbows for like years, believe it or not, 2 or 3 years. And I had a laptop, and I got into the early versions of AI, and I brought up all of my old tech brain. I revived it, and I moved here to Michigan. I got surgery, and I'm walking, and I was not projected to walk. And what I began to realize is that, you're only going to get a good AI. My mentor told me, he said, look, here's why you can pivot. You're going to recover. You're going to make it from this. He said, you're going to walk again. You're going to stand up again. I'm not going to break down in this podcast. Anyway, he told me, I'm going to try very hard. He said, you're going to walk again. And he said, and this is what you're going to do. You're going to find people who are passionate about mental health, chronic pain, recovery, and health issues, and you're going to give them tech. You're not going to start with the nerds like yourself. You're going to find the people who are already passionate about sharing, about helping people, about lifting people back up, because you've already realized that no matter what we do, no matter how good the AI is, it's only going to be as good as we are to each other. It's going to have those qualities. And if we are intentional about putting those qualities into each other, and the best things we bring to relationships, the best thing we bring to our family, the best we bring out of ourselves, that's what we're going to get. There's a lot of concern about healthcare and mental health. Struggles with getting help for that. My struggles with neurodiversity, with dyslexia, just pushed me into technology. And I realized that inside this same technology was salvation, redemption. There was the potential to turn around inside the technologies that I was learning and use them exactly to mitigate the stuff that I'm going through, that my kids are going through, adults with autism. And so we developed Smart Brain. Smart is basically an ADD technology that is going to be a companion coach for people with ADD. It's going to read in their symptoms. It's going to talk to them about it. It's going to engage them. It's going to proactively check in with them, right? If I had something like that when I was going through the diagnosis part, it wouldn't have been a case where nowadays they just give you medicine. It's just pills for everything. When I was coming through the spine surgery, it was pain pills. No, it's not that. It's about healing. And these technologies have tremendous potential. If you want to have an impact greater than yourself, you have to build platforms, not projects. You build platforms for other people to launch. Eventually, I want to build platforms for smarter people than me, younger people than me, people who look better than me, are not as old as me, didn't go through as much stuff as I did. They have better ideas than me. And if I can be a part of, specifically regarding health, mental health, healthcare, and things like that, to build solutions and platforms for them, I'm happy with that.
That's amazing. I mean, that is literally a miracle story to be able to go through that experience, be able to walk again. And I'm super supportive of the community you're building and the mission that you're pursuing. One of the reasons I started this podcast is to shed light on AI use cases like this. How are we applying AI in our everyday lives to tackle the problems that we really struggle with when it comes to healthcare, mental health, isolation, self-esteem. So how do you see the use of AI in particular helping with those really, really tough areas.
So now there's such a thing as concierge medicine, and for a long time, people who were very wealthy had concierge medicine in healthcare, meaning you could just call up a doctor, put them on retainer and see them whenever you wanted to. Cost was not an issue. What I'd like to do is kind of bring that experience, right? So let's take mental health. Let's take the therapist I'm working with. I got 2 psychiatrists and 1 psychologist. We're all collaborating on something called Therapy Assist. The number one thing, once we talked to all of their clients, once we found out about what was going on with their clients and how could they help them better, like these 3 people care about their paid clients. They could care less whether they have 50 or 1,000 clients. If they're helping their clients move to a better space, they're happy. They said, look, between every month or 3 months, our clients can't afford more appointments for every 3 months. I said, well, what are you doing between then? I don't have time to call them. What if you had an AI that was basically, it looked like and we trained it on your dissertation. We trained it on your best practices. We trained it on your therapeutic insights, on your mannerism, on your compassion, on your empathy. And we said, we're going to give this to your clients. So halfway between your last appointment, this thing is going to reach out, a little automation mixed in there, and it's going to say, how are you doing? The last appointment, you talked about this. Is that going okay for you? Do you need more medication, less medication? I know you're taking this. Are you running out? It's going to have these things where it's going to proactively reach out. And I might break down, but he has one client who was unfortunately on the road to suicidality, right? And he told me this story that he just had this feeling that he should reach out to her between sessions. It's something, she kept coming up in his mind. She said, I can't see you. I'm going out of town. I'll be back for 2 months. He came back and he just called her. And the moment he called her and said, how have things been? She said, I was just about to, I didn't want to call you. I didn't want to bother you, but I've reached this point. She's back from that. Now, if you'd have waited 2 months or months, who knows?
Just a simple outreach to say, hey, I'm here if you need anything.
Yeah. So he was like, what if this AI could do that? So it's in the testing phase now. Right now, the automations and everything are working great. Sabrina, let me tell you, these clients are like, they don't know they're like, they thought it was him first, but we said, this GPT is emailing me, is SMSing me. How are you doing? Checking. So the therapist, so normally most therapists, social workers, right? They have to spend a half hour of the hour session catching up on what happened before, right?
Now the GPT can summarize it with all the key takeaways, identify the things that's struggling with.
Get mad. They come back and the therapist told me you were struggling with this on Wednesday. You got a new job? Was that stressful? Yeah, it was. So all that catch up is done. They get the full hour. And going forward, what happens, instead of getting 15 to 20 minutes of therapy per month, you're getting the full hour plus that in-between engagement that has CBT schedules, that has therapeutic advice based on his articles and based on stuff.
Sounds like it's enabling a new model of care, which is continuous care.
Yes,
it's not just like you show up at the appointment, that's when you get your health care, but instead it's a more holistic approach that stays with you and it's there for you when you need it. Maybe you go through a couple of weeks and you don't talk much. You're doing great. But then the next couple of weeks, something happens and it's there, and maybe you can more easily schedule an appointment if you need to come in sooner. Like all of these, not just logistics, but being able to provide that holistic, continuous care.
You got it. Yeah. And they're loving it because when they forget an appointment, when their medication runs out, it can handle all those types of things for them. So now we have a model for physical therapy, which is doing the same thing. Here's the other potential power of AI. There's some recent articles that have said AI is kind of outdoing doctors in terms of diagnostics, right?
Yeah, just saw another one pop up this morning on O1 testing. Yeah.
Yes, they're not upset about that. They were like, look, how can you develop something that will help me with my DSM-V, diagnosing these mental health issues? So I can run it through a second opinion. I can do this kind of stuff, And so now we're developing like a support for the actual therapist, the social worker, et cetera, that helps them with this diagnosis. That is, it automatically updates. It's going to be bringing in the most current information, all of that, because if we're going to make a difference with healthcare, it is going to have to be continuing. Across the board, no matter what kind of medical or healthcare or mental health care or even just trying to be a better person, coaching, the problem is gaps. There's no continuing. You have to go back and pick up and go back. This one step forward, 2 steps back thing is...
It feels like a broken experience for both parties, for both the patients and for the person trying to help.
And they give up. And what happens is when that happens too much, fortunately for that young lady, we didn't lose her. What happens is people give up. I can't reach my therapist. I can't call him. It's busy.
Or it's too expensive, as you said before.
Or too money. Yeah.
You're making continuous care also affordable and accessible to everyone, which is a really key point.
That's the idea. Yeah. That's the
and
power,
so just for the audience members who may not be familiar with Launch Lemonade, can you talk about your process, like your initial vision for what you wanted to build, some of the challenges you were having in terms of building it out? And then what happened with Launch Lemonade, and how did you get to the prototype that people are using today?
I filled up several GPT, several personas, several chats. So now I'm going to go back with under the LLC, and we're going to try to actually use real clients and have them test it. Now, if I have to eventually build out a whole big platform, great. But that might happen if healthcare organizations, because we have some inquiries from Henry Ford Health, even some local collectives of physicians and doctors that are saying, look, we're having a meeting, got 5,000 doctors coming. If you did something for our whole organization, what would it look like? Right now, that's overwhelming. But with the testing information that I can get from Launch Lemonade, scale up when need be, and very quickly and easily, because it has subscription built in. So I can have the doctor subscribe. The doctor can just pass that on to the client if he wants to. It has different tiers, different levels, access, the branding. Like even the psychologist that I'm working with right now, he says, look, if you need a little extra money, I'll kick it to you, and then let's kick it up the membership when we go back in so that it's branded him and associates, Dr. So-and-so and associates, and it has a little avatar and it looks like him. So it really takes on a more of a personal thing. And I think that's important, because if you're building platforms, a lot of times if you really want it branded for your people, for your tribe, for the people you want to reach, the people who are really looking for what you have, having consistent branding and being able to say, go right there, go there, go there, instead of you have to go to my website and then click on over here to the ChatGPT site and go, all of that worked really well. And I'm anticipating that's going to work extremely well.
So how is it deployed now? Like, how are patients or test users interacting with the chatbot?
It's designed to ask any questions that they want about their particular care. And we had two models. One, it was geared toward a particular person. Now, in real life, we're going to have that person's data segmented so that when they log in, it's them. It can go back and look at all of their data, look at their chat history, their medication information, all of that, and say, hey, it can give a very comprehensive inquiry, right?
So the chatbot will have context on each individual patient,
yes,
kind of like a mini knowledge base, personalized for each patient.
Yeah, and in general. So, and then also it has some general information. So he can send general patients there to find out about diagnoses, about their particular diagnoses. It's going to have general information. What I like about it is that all of the curated best practices from these physicians and psychologists and psychiatrists that I respect and know are really care about, and I know they've done their homework, is what it uses. It doesn't just go out and drag stuff all over. Dr. Leem, the doctor, has talked with you about this. He's guided you through this before, and it will continuum of care. Also, you get the continuum of compassion, the continuum of engagement that stays in that very trusted place. You know what I mean?
Yeah, you actually feel you have a tribe, a little community around you that's continuously there.
Yeah.
I'm curious the initial reactions from other physicians and clinicians. Like, is there a fear that this could displace job opportunities, or are you noticing people start to embrace it?
I've looked at some med students. The ones I've had a kind of conversation with and the ones I've shown the demo, it is like night and day. Like I showed a psychiatrist what it looks like, what his client is going to get when he's not in contact with them. And I showed them the updated case file and notes that the GPT provide. And he just teared up because he said, I've always wanted to do that. But the balance between me reaching out to these clients and bringing in new clients and dealing with them personally is just too much. You can't maintain it.
It's really tough to scale personal interaction in a way that feels authentic, that it's very customized and tailored to each patient's situation.
So he sent out email reminders. He did all the other stuff before, but this had a feel. And I said, man, look, it's you. This comes out of conversations and extensive interviews I did with him. All of that is trained into the GPT. And this is what he said. He said, it is engaging people the way I would engage them. And I would be proud and be happy. And I would be relieved to know that they're being engaged by this, which is not just something very cold and it's
not generic. It's really fine-tuned for that specific position. Yeah.
Okay. Another one we did is called a diabetes educator. It's a GPT, and that is as a profession that a lot of people have. I mean, if you have diabetes, you can go to diabetes educator. They'll call you. They'll do all this stuff. Again, there's too few of them. And unfortunately, there's a epidemic of diabetic symptoms running out. And so where you can go for good information. So one doctor from Kenya, she has 3,000 patients. He said for 200 of them, they are diabetic. And she says, I want to be able to coach them, but I cannot coach 300 clients. So I was like, well, what if we created we create a diabetes educator, a diabetic assist, right? And it would take in their symptoms. It would give them the most curated current information you want to provide for them. And it would assure them. It would have a way. So if they had a crisis, they could literally, it would say, look, do you want me to call the doctor? I'll let her know immediately you want to talk to her. Or here's crisis information if you're having a health crisis. And we built that into mostly everything, that there's some sort of button where if it gets urgent, immediately the therapist can be alerted, SMS or something. We're trying to
That's
build that
great.
in.
Yeah. I
Yeah.
was going to ask that, like, how do you ensure ethical use, guardrails, being able to detect when things are kind of going off
Oh,
track and when a
and
human might want to step in, whether it's just somebody on the team to take a quick look, maybe
yeah,
if it's a
yeah,
content gap, fill in the knowledge
yeah,
base with additional
yeah.
information, things like, how are you thinking about architecting the
So
guardrails around the system?
So we actually are going to have some interns and even people that we hire that are going to do that. And the testing we're doing is rigorous because the last thing you want is for this GPT to say something to someone that is therapeutically harmful or even misguiding. That is a huge liability. And a lot of the doctors want to know, how do we mitigate that? So a lot of that comes with a lot of heavy monitoring. I'm even experimenting with building some GPTs, and that is their job. Their job is to look at the knowledge base and review it and automatically go back and forth and
So
then
you're building like a whole agent system, it
yeah,
sounds
right.
like.
Yeah, because they're going to monitor themselves. I'm not doing that. I think what happened was because I got very good feedback from physicians and doctors and psychiatrists and social workers, a lot of this medical stuff is administrative load, right? So even before we do GPT for a lot of this other stuff, if you can mitigate the administrative load, the quality of care just takes these exponential jumps up. The doctor's not worrying about the appointment. And the other benefit is privacy. I can absolutely assure them that when a patient's information is put into that very exclusive database and locked down, when I lock that stuff in, there are no errant phone calls. There isn't, oh, I'm sorry, I just gave all this private, personal medical information to the wrong person. We can ensure a much higher comfort level and safety level. The AI is not going to talk about your mental health issues with the other AI. Hey, you know what he's struggling with? What's wrong with it? That's not going to happen. It's going to stay in its lane. It's going to do what we tell it to do. And the training we're doing is rigorous. I mean, we have a very high level of threshold for mistakes. We trick it. I mean, we have AIs that are, so we have one AI, one GPT specifically designed to come up with personas of potential clients and patients and different diagnoses, different names, ages, ethnicity, all of that. And they go in and they have to test, and they are designed to query this AI and say, give me bad information. And we're doing like a lot of research, of course, using these GPTs into HIPAA regulations. Like we have one which is going to experiment with, try to keep updated on all of the kind of HIPAA privacy regulations that are applicable. So it's designed to go find that out. And it's designed to report back to us and to give us insight into any major changes and any of the stuff. The doctors themselves have been the most helpful. Like therapists I'm working with, we sat down over a period of weeks and just went through all of the different HIPAA hiccups he has, all the problems he has, all the stuff that he does and needs to do to keep all that stuff safe. The idea here is that we can start out with these very generic personas, and we can, in the testing phase at least, we can always scrub the personal data and just assign a code or something like that, and then we can test it. But the main thing is a lot of rigorous testing. We really want to make sure this thing is not giving out any answers. And because I had a friend who asked a question, he said, look, what if someone just types in or says verbally, look, I don't want to live anymore. And at the moment, our protocol is that it immediately shuts down responses and it says, are you in crisis? And then we're working on a protocol to where it will automatically go out to SMS or 911. It will flash and say, hey, it sounds like you're in crisis. Let's get off of this and call someone. And then it can either call the therapist directly or whatever, depending on how much of a human interaction we need, depending on how well the automation works, so that it is as close as possible. Because I talked with doctors, I said, what if we have people, there's a list of the 10 questions we have. And this 10 questions are some very serious, sobering, somber, sad questions, but it has to be able to answer those. Or at least it doesn't have to be able to answer it. It has to be able to direct it appropriately. I don't want it to sit there and go back and forth with someone who says, I feel like not living. Well, why? Why don't you? We're not at the point now where a GPT, no matter how well trained, can talk someone down from that. It can, but we can't depend on it. That's where the human element comes in. For me, that's where having therapists and physicians and psychologists who are caring and who are empathetic and who are knowledgeable, right? And they're on the right side of this. I mean, not saying there's someone on the wrong, but they really are. They do want the best for their patients. They give us this feedback and this input, and we train a lot of what we do, to be honest, on the personalities of these doctors and therapists. I mean, they go through like a rigorous screening, and they're referred personally. People we know, we talk to their patients, and they are just they care. They have helped me through this. They helped me through that. We've never had an issue with them. So there's this vetting process. And once we get them, we're training the GPTs on these personalities. Now, eventually, we may have quasi-therapeutic personalities. Now, that's where the doctors are a little more uncertain. You might have GPT with robotic administering massage or acupuncture or cupping. But for right now, that human piece is really necessary. And a lot of the doctors, because they have such a caring background, and I want to be an advocate for people in these areas and in these spaces behind AI. A lot of the patients, believe it or not, with the second brain, they didn't even realize it was an AI. Are you typing this stuff in? I was like, no. They said, this sounds like you. I was like, no, I'm not doing that for all you people. I'm not a therapist, I'm not a counselor, I'm not your coach. I need to make sure it's safe, et cetera. Eventually, yes, you can have people subscribe. I might do an article, Attitude Magazine has expressed an interest, so we'll see how that goes. The idea is that these things are available in ways that facilitate the healing from therapists, from these professionals, to the people. If we just did that much more efficiently, that we help the existing stuff get to them quicker, get to more of them, and be better quality, we wouldn't have to worry about Terminator AI because it's coming from people to people through AI.
What really strikes me in your description of everything is how closely you collaborate with healthcare providers in building out the platform, even before starting to build it out. It's how you've navigated the healthcare system, the complex U.S. healthcare system yourself, and had your own experiences. But I am curious, what's your biggest challenge right now? So you have a big vision. It seems like things are going really well. You're getting a lot of validation for it. You see a clear path forward. Technology doesn't sound like it's the blocker anymore.
Yeah.
What do you think is going to be the biggest challenge to get this to thousands, eventually millions of healthcare providers?
You're going to have trust. And what I like about code and what I've always liked about technology is that it's possible to build trustless systems that do not require you to worry about if this person is going to share your private information, because if we secure it well enough, it actually has a higher percentage of keeping your stuff private than other stuff, than human beings. Like I said, I painted the picture of the people who are really willing to work with us. There are other people that are very afraid. I mean, there's some doctors that really do. They think they're going to replace. There's therapists that are really concerned about that. What I will say on the part of most of these therapists and people that we're involved, social workers, etc., they're not afraid of losing their job. They could care less, really just want the best. That's who you want taking care of the babies. That's who you want taking care of your family and your children. Parents have to worry about whether or not this thing is telling their children the wrong thing. And so trust and adoption, especially when it comes to healthcare and Medicare. So it's these chains of trust that, unfortunately, the biggest barrier in healthcare is because people are trained to mistrust anything coming from the healthcare system. What I found refreshing is that if you position yourself as though you're trying to help people get good healthcare, regardless of what that system says, you're like, I don't care if you can't pay for, like the doctor, he's trying to fit the psychiatrist, he's trying to figure out a way. He said, look, I don't even want to bill for this because as far as I'm concerned, it's like hiring an answering machine financially. I don't want them to pay more for this. So we're going to build it so that it's included in all of that. And can you imagine with the same $70 you're paying, now you have someone contacting you. You have a system that is reaching out to you in the middle of 2 weeks saying, hey, your next appointment's coming up. Did anything hit you pretty hard this week? Are you doing okay? I was just checking in. I'll let the doctor know. That's all included. So the same money, the quality really increases. Now, of course, I think long-term, we're going to have problems. We may have problems with larger healthcare systems. Like if we could, like we're talking with some people at Henry Ford and things like that, the whole paradigm of profitability versus wellness is going to come up. I think long-term though, it might be a way to have both sides realize the benefit of technology and AI to actually help patients and not to make them overwhelmingly profitable, but at least make them profitable enough so that they can continue to do the business that they tell people they want to do, which is help people and make people better. And then there's the clients themselves. There are communities out there that the more I talk, the more I study, I often assume that the people outside are just as informed and willing as I am. And they are not. I had this one guy, and he was like, he said, you can't trust AI, man. I was going to write a sarcastic Onion type article about AI and why you can't trust it. And a friend said, don't publish that. He said, don't publish that because you think people will take it as sarcasm. He says, he said, you will set this whole community and neighborhood back because there's like a couple of neighborhood organizations in Detroit that are doing good things. He said, if you write this article, they're going to read that and they're like, I knew it, and then it's going to be over. You will not recover. So I said, where you can only do so much Onion. But I think the issue is trust, and that takes time. I think what will surmount that is transparency. I want you to see I want you to see the code. I want to show you what it looks like demonstrating it for people, showing people. There hasn't been a patient or a client or a doctor that I haven't shown and they haven't interacted with this thing to where they cannot believe the quality of care. And I always tell them, I say it because it was trained on you, man. That's your heart in there. I did my best to put your heart in there and to be your knowledge in there. This is how you would want them to be. And if it's not, we're not going to do it. If this is not how you would treat, if it's not giving the answers and the guidance that you would do it, scrap it. We'll work until it's done, or we'll leave it alone. And when you open people up to that, they begin to see that AI is just another technology, like a scalpel or a massage table. It's just there. And it's just a little smarter than the therapist's couch. It's a little smarter than a scalpel. It's a little smarter than that. If properly accessed and utilized, it can have tremendous benefit. But it goes hand in hand with digital literacy, right? So I'm developing some educational things alongside with that hopefully out in the community and the people who are going to need this care, that they start to already understand what it is and what it isn't before it gets to them. Here's a tablet. Check this out. I made a GPT about your community. Oh, wow, that's what it is. This knows everything, that kind of thing. Here's the GPT about from the kids. Look, y'all kids can train to do whatever you want to do. I'm going to make it do this. It does what you tell it. See, so the stuff like that is going to be important, absolutely important. So that's the biggest challenge, is this idea of trust. But I think adoption is coming along as long as I stay in contact with the people on the ground, people like you, who keep me looking up and into the future of where it is, right? And strike a balance with looking at talking to the patients and the doctors and the caregivers.
Yeah,
and
with where we are today with our current systems.
But balance, if I keep that balance, I think some really good stuff can come out. That's what I hope to happen. I think as platforms become easier to access and cheaper, like I said, I ultimately want to build a platform where I'm not the only one doing this, but smarter people, younger people, better people, people with more ideas than me can stand on top of what I do, and one day might do something and then look back like, I don't know who this started, but this is, I don't care if I disappear. That's okay. Are you doing something better? If they've taken it and done something better with it, Uncle Yusuf is out of the picture. I'm cool with that.
I can definitely imagine a pretty large platform tailored to healthcare. So it has all the HIPAA compliance. Maybe it has integrations with EHRs like Epic and some of the other big ones. And it's just really, really good at creating a fine-tuned custom GPT where each patient has their little knowledge base that the GPT knows and can provide that kind of continuous care and support, regardless of what specialty it may be, right? So it might have different playbooks or frameworks for each specialty, whether it's clinical care, physical therapy, or something else, but there's so much potential here. What would you say to other folks in the healthcare space or interested in doing something meaningful in the healthcare space who are looking for ways to get started?
All right, you can contact me. I'm going to regret that. But I'm also putting together like a GPT, which helps to facilitate that, like some trainings and workshops specifically designed for healthcare workers, social workers, things like that. Just to say, hey, this is what it really is. This is what AI really is. This is what the potential of AI could really be. If you're in healthcare, if you're in medicine and things like that, reach out to someone who knows about GPT. Start with the basics. Start with how to integrate prompts. Start with personas. Just start with personas. It doesn't take long. It took me not too long to get to the point where now I'm even looking at maybe building some custom LLMs for these, because for this kind of health thing, you may need to actually go to that level. But if you're a doctor, the important thing is that you come to understand and you have a good grasp of what you want your patients to have, the care you want them to have. Like I said, these things are trained on the hearts of doctors and trained from the minds of the physicians who are helping these people. If you really care, these things can help you in ways that maybe medical school didn't prepare you for. I mean, a lot of the stuff is being slow to integrate into medical school and things like that, but find someone, find a source, find a platform and start experimenting. Read the articles and take the time to really digest what LLMs is and what an LLM is, what a prompt is, what a generative AI does, and then think in terms of the best possible outcome for your patients. Right? It's like selecting a new piece of equipment. This is how I talk to doctors. I say, look, if somebody brought you a brand new MRI machine and all the patient had to do was walk through it, oh, is that in development? Are they doing that? No, but I want you to make they would throw out, they would throw that old stuff out immediately. So when they see when they see people like you, right, and me, that are telling them that this is good, when they see the light, like I consider you one of the light bringers, when they see people who are trying to shine light on the light that AI can bring, right? We're not going to be these Debbie Downers. We're also not going to be unrealistic. We're going to be careful. We're going to be meticulous. We're going to be innovative, but we're going to find a way that you use this hammer to put these nails in. We're not going to be hitting them with rocks anymore. We're going to do this. And most doctors, most physicians, because they're experts and because they know what it's like to study and become experts on something, I believe that most of them do want the best for their patient. And the best outcome for the patient is going to be with an integration of this technology like anything else. Medical field, what happened? They went from knives to scalpels. They went from lasers to robots. They went from nothing to antibiotics. So every innovation in medicine has been about improving, whether it's mental health, physical health, physiological, neurological health, whatever. Medicine, if you're in healthcare, learning about this is the best thing that you can do to not only do it for this generation of patients and medical professionals, but for the next generation, that they see your example in modeling how to integrate this technology as your predecessors integrated all sorts of life-saving medicines, penicillin, and technologies that helped millions of people survive that would not have survived otherwise.
Well, Yusuf, you are a star example of why I'm super passionate about AI education. From the very beginning, my goal has been to educate folks outside of the traditional tech sphere so that folks like yourself can build meaningful solutions for your micro communities and where you have domain expertise.
It worked.
I have nowhere. I know, yeah. I have nowhere near the expertise you have in healthcare, navigating the healthcare system personally, insurance, all of that. But now that you are inspired by what you can do with AI, you see the massive applications of it.
You got to keep doing it.
And so I
you
just
never
want to
know.
say thank you for joining my podcast.
Thank you so much. I appreciate it. I love it. I'm going to be watching. I'm going to still be in the comments with questions, but I'm so happy because, like you said, there's not a lot of people trying to do it right now. And I think the real reason I do this is because we're not going to have healthy AI without healthy people,
Yeah, we need people like you driving what AI looks like. So.
That's the idea.
And so, for listeners out there, how can they find out more about you? How can they reach you?
They can reach me by email. We can make it available. I have a couple of GPTs that explain a lot of what I do, a couple of demos up, and I can make those available to you, and I can let you guys know what web pages are for those.
Okay, great. So just check the links to the YouTube video and the newsletter, and we'll have them there. Okay, cool. Any last topics you wanted to touch on before we hop off?
Just want to say thank you again. There were times when I didn't think this was going to be possible. I didn't think it was possible to find a turn corner on pain and surgery and all this other kind of stuff. And I had reached a couple of low points. Didn't know if it was possible. And I believed it was possible, but I didn't have a certainty that it was possible that we could use AI to do this. And because I think I saw it happen in my own life. And when I used AI to heal myself and to strategize my recovery and to do that, and I saw that it helped other people. So I would like to tell anyone out there, I know it's difficult, right, to dive into the parts of your life that may be painful or hurting or not quite working right, but go ahead in there because like Rumi said, the wounds are where the light enters. Find out where the hurt is, where the struggle is, and you can't go wrong putting all of your effort, all of your hope, all of your dreams, all of your intention into bringing whatever that light is out.
That's a beautiful message. Resistance is the hint to follow.
Yeah, that's it.
Well, thank you so much for joining the podcast. Seriously,
Thanks,
it's
Sabrina.
been such an incredible podcast meeting you, and I really want to support your journey. So please keep me posted personally and let me know if there's anything I can do to help.
All right, I will. All right, thanks, Sabrina.